Hello, I'm delighted to welcome you today in this video. My name is Dr. Alvarez. I am the Chief Surgeon of Haus Clinic, Aesthetic Medicine and Surgery Clinic in Barcelona. In this video, we will explain the options available to improve your cleavage and be able to wear the dresses that you always wanted to. First, we have the non-invasive options. Invest in a push-up bra, are an easy and affordable way to instantly gain a cup size or two. Push-up bras make cleavage appear larger, younger and firmer and can be purchased at any bra store or most regular store that sells bras. Look for a bra that pushes breasts together while lifting them. Look for a bra with a wide backband for better support. The pros of this type of bra: they are cheap, affordable. The cons: that you only get the cleavage with the bra. They get worn. It's not your breast, it's the bra. The effect might change a lot depending on the brands. They can affect the breast tissue because they are very tight at the level of the breast fold. You can get problems afterwards. The padded bras. The padded bras boost your breasts at the bottom, lifting them upwards to rest at the top of the padding. Look for a bra that suits your body and doesn't cause them to spill your breast out of the bra cups. Look for a padded bra if you're using a deep cut top. The padding can centralize your breasts and improve your cleavage. Padded bras normally are tighter than regular ones, so you might search for a bigger size than your usual. The cons are you only get the cleavage with the bra. They get worn. Accidents might happen if your breast spills out of the bra. They are too tight on the inframammary fold also. Silicone chicken cutlets. If you want full gravity-defying cleavage like Kim Kardashian, wear a push-up bra and insert a silicone chicken cutlet in the bottom of each bra cup. The cutlets will help boost your bust and make your breasts look fuller. For deeper cleavage, apply the cutlet on the outside of each breast and place the cutlet high on the nipple instead for a centered top of it for a pericure breast. Buy your push-up bra in your correct size, but look for one with a tight band. The cons: and they lose glue easily and they tend to hold the skin smell and they smell a lot after some use. When they get dirty, it's usually difficult to clean them. Breast tapping. Although a bra provides the best support for your breasts, there are times when it's not possible to wear one, such as when you're wearing a dress with a plunging neckline or an open back. In those instances, tape is the perfect solution. Corsets have evolved beyond their historical associations and they are not widely used by modern women to shape their bodies and enhance the appearance of their breasts. Creating a more defined and accentuated figure makes the breast look larger and more pronounced. The cons: they look outdated and they are not very comfortable. Also, you only get the result wearing a corset. Enhance your décolletage with a touch of bronzer. To accentuate your bust, get a soft power brush, a bronzer shade darker than your skin tone, and a luminous bronzer. Dark bronzer where you breastaugmentate your cup, done in the inner edge of the cleavage. Repeat this in the other side of your chest. Brush the light bronzer in a straight line along the middle of the cleavage and across your collarbone. Lift your breast through exercise. Working out your pectoral muscles as you are getting ready can actually make your breast look larger. Pro: minimum lift. The cons is you exercise too much, your breasts might fade because of your fat loss and they might sag more. Then we have the mini-invasive method, the hyaluronic acid filler. The breast augmentation through the use of hyaluronic acid filler has become a popular trend in recent times. Those fillers can instantly enhance the size of your breast, giving you the desired fuller look. However, it's important to note that there haven't been enough studies conducting the long-term effects of these fillers on the mammary gland. So, with caution when consider this procedure. Additionally, it is worth mentioning that the effects of the filler are not permanent and you undergo the procedure once a year to maintain the desired results. This can be quite costly, with prices ranging around 1,000 or 2,000 pounds per year. Furthermore, there is a possibility of allergic reactions in some patients, and it's crucial to consult a qualified professional before opting for this method. In conclusion, while breast filler can provide instant results and give you an appearance of bigger boobs, it's important to weigh the pros and the cons and inform decision based on the individual circumstances and preferences. Breast fat transfer. These innovative solutions provide a gentle liposuction procedure to collect a small amount of your own fat. After processing, this fat can be carefully placed inside your breast through a small incision. The pros is that your own natural fat is used to enhance your breast, resulting in a more beautifully natural outcome. This method eliminates the risk of rejection since it uses your own tissue. The cons: the scarring from the breast fat, where you get the fat and when you put it. This might affect mammography results. Weight loss can lead to a reduction in breast size, while weight gain might cause an increase in breast size. More research is needed to fully understand the benefits and the potential risks of aesthetic augmentation with fat transfer. It is necessary to undergo a liposuction procedure to collect the fat needed for this breast transfer. And lastly, we have the surgical option. At this time, breast augmentation with a silicone implant is the gold standard for breast augmentation. They allow us to get the best result choosing between the type of projections and allow us to raise the breast much easier than without implants. When it comes to breast augmentation, there are several choices to consider regarding the type of implant and type of incision. It is crucial to have a discussion with your surgeon to understand the options fully. Implant surfaces. There are two types of implant surfaces available: smooth and textured. Textured implants have small bumps in the surface which are designed to reduce the risk of contraction, a complication that can occur after augmentation. Macro-textured implants have been discontinued and currently only use nano-textured ones. Smooth implants, on the other hand, have a smooth surface and are preferred by many surgeons like me for a softer, more natural feel. And they also have the advantage that the risk of contraction is almost zero if you use them in the retromuscular plane. The implant filling. Women have the choice between implants filled with cohesive silicone gel or saline saltwater solution. Both options have been used for years in breast implantation. However, many surgeons and patients agree that silicone-filled implants provide a more natural feel. They're filled with silicone gel that stays in place in case of rupture and has no effects in the rest of the body. Shapes. There are two type options for implant: teardrop or round. Round tends to conform better to a natural shape of the breast and often yield favorable results. Depending on the result we want, we can choose between moderate projection for a more natural look and a subtle cleavage, or high projection for a more marked cleavage, no artificial appearance. If you really want an artificial result with great cleavage, we have the extra high projection, the porn style look. Teardrop or contour implants are suitable for women who have had parts of the breast removed in previous surgery, such as mastectomy reconstruction, or women with very small breasts that need to reconstruct the whole shape of the breast. Placement. Implants can be placed either behind the breast tissue, subglandular, or behind the pectoralis chest muscles, submuscular. Studies show that submuscular placement might reduce the risk of scar tissue contraction and allow for easier mammography. It is often the preferred option for thin women or those looking for a significant increase in the breast size. It also allows a good coverage in the upper part of the breast in patients that have little mammary gland or very light skin to avoid the rippling in the upper part. Another of these advantages is to compress the upper part of the prosthesis to create a more natural appearance. The subglandular placement might be more suitable for women with sagging breasts or patients with a lot of breast tissue. Incision types. We have different type of procedures for breast augmentation. The inframammary fold, incision in the fold underneath the breast, allowing the surgeon more control of the implant positioning, and is a popular choice, especially for the patient or women, and the natural sag of the breast helps hide the incision. The transaxillary, this procedure involves an incision in the armpit and allows for insertion of the implant above or below the muscle. It offers the advantage of no visible scar in the breast itself, but it might be more challenging to achieve symmetrical implant positioning, and the scar might be not so good in the axilla. Periareolar, this is an incision made around the nipple, areolar complex, with a scar in the edge of the areola. However, it might affect some type of breastfeeding and nipple sensation. Transumbilical augmentation, this new approach uses an incision through the belly button. There is a slightly increased risk of implant damage, and manufacturers might not honor the implant warranty. Surgery length. A primary breast augmentation can last as little as 1 hour. The sensibility. It won't affect sensibility. The risk is nearly zero in some mammary approach, and a little bit more in perioral approach, but it's not too much, like 5%. Breastfeeding. Not affect the ability to breastfeed during lactation, unlike breast fillers and lipotransfers that we don't have sufficient studies. It is important to consult with your surgeon to determine the best implant and procedure option for your individual needs and goals. For this, we conclude that a breast augmentation with a prothesis is the safest method that lasts longer, affects the gland less, and allows breastfeeding without affecting sensitivity. It allows us a great versatility depending on the results you want: more natural, more leg-like, drop shape, more cleavage. In addition to being a result that lasts over time, it allows you to wear dresses with a neckline, without a bra, without the need for a push-up or the tapes or the chicken cutlets. Currently, simple breast augmentation surgery can last as little as 1 hour, allowing for quick recovery, showering the next day of surgery, and taking a flight after 7 to 10 days with our Amar technique. Thank you very much for listening to this video that we made for you. Thank you.